the acid-base balances. So our first topic, or in terms of the reviews, I did mention that we'll be talking about the acid-base balances. Please pay attention to this. When we talk of respiratory system, the main function of the respiratory system is to get you in or to breathe in oxygen and then you breathe out carbon dioxide. As I mentioned, the main reason why we breathe in the oxygen is to help burn the glucose that we have, which is the end product of digestion. Now, without oxygen, cells will not be able to get the energy that they need. So, oxygen is used for metabolic activities, or in other words, we say that oxygen is for combustion. So, you combine glucose with oxygen, you produce energy, and in the process, we produce carbon dioxide. The carbon dioxide needs to come out from the body because it's toxic. The accumulation of this carbon dioxide will result in a condition called respiratory acidosis. When your carbon dioxide levels are building up, they will combine with water to form what we call carbonic acid. Nobody will ask you to define what carbonic acid is, but understanding this will help you know the importance of getting the carbon dioxide out. And so most of the respiratory problems that you're going to be seeing is going to be a ventilation problems. So anytime you have a problem with breathing out the carbon dioxide, you are creating a condition that will drive the pH down. The normal pH of a body is going to be 7.35 to 7.45. This time around, NCLEX will give you this value. You don't have to memorize. But when the ABGs comes, they will tell you that the pH is, let's say, 7.30. You know that in this case, the pH is low. Whenever the pH is low, then we say that the person is in acidic condition. And then when the pH is high, in this case, greater than 7.45, we say that the person is in at risk of getting into alkalosis. So let's look at some of the conditions that will cause this pH to go up or to go down. We'll start with things that will depress the pH. So let's look at it. The first thing that I'm going to talk about is drugs. Anytime you take medications like opioid, this will drive the respiratory system down. And so when you look at the person's respiratory rate and is less than 12, please start thinking about this person building up carbon dioxide in the system. And this will cause the pH to go down. If you give any form of sedatives and the respiratory rate is coming down, think about the person going to be building up carbon dioxide, and therefore the pH is going to drop. In this case, all we are saying is that whenever carbon dioxide levels are going up, the pH will be dropping. And in this case, we see that this person is in respiratory acidosis. Let's look at edema or pulmonary edema. Anytime we hear the word pulmonary, we're looking at the lungs and the airways. Again, when we have fluid built up in the case of a heart failure, we risk building up carbon dioxide in this case. And so, what is going to happen is that this patient will be building up this carbon dioxide, and this will drive the pH to go down. So when we have a condition like that, in the case of a heart failure, as a nurse, you'll be thinking about probably giving diuretics to what? To diurese the patient and bring this fluid out. Be your main intervention. In the case of the drugs, where I did mention about opioid, you're thinking about giving the opioid antidote, in this case naloxone, or you'll be giving Narcan, and this will reverse the effect of the opioid. If it's alcohol, these are all things that think about what is in the question. That will determine the intervention that you are going to put in place. Let's talk about pneumonia. Pneumonia is when you have inflammation in your alveoli, and in this case, it could be that of an infection where the person get the infection from the environment. We call it community acquired pneumonia. Sometimes we also get this pneumonia after surgery, where the person has been on a ventilator for too long, and in the process, they are not using their lungs. So when they come back, we give them what we call an incentive spirator to help them expand the lungs and prevent them from getting the pneumonia. Another way to get pneumonia is when they aspirate. So aspiration is one of the causes of pneumonia. So in this case, to prevent that, where we have the risk reduction questions, you have to raise the head or bed up before you think about giving them anything to eat. And again, when they come from any procedure that involves the gag reflex being when the gag reflex, when you put the person on NPO and then the gag reflex has not been returned, do not give this patient anything to eat or to drink until the gag reflex get back. Because if you do that, you risk you risk this person of getting pneumonia. Let's come to respiratory failure. What is respiratory failure? This is where the person is not able to breathe in air or the oxygen and then get rid of the air. So we have a big problem. In this case, when it becomes very severe, the provider will decide to intubate this patient. And when I mention intubation, intubation is nothing but putting in a tube into the person's airways and then connect this tube into the ventilator, where a machine will now be doing the ventilation, that is breathing in the oxygen and then getting rid of the air, which is the carbon dioxide. This is all we are talking about when we talk about respiratory failure. In all these cases so far that I've talked about, you realize that we are building up carbon dioxide in all these cases. Let's come to emboli. When you hear the word emboli, we are referring to a blood clot. When the clot is found in the respiratory system, it is called a pulmonary emboli. The same emboli, if it finds itself in the brain, we refer to it as what? Stroke. When it finds itself in the heart, we'll be talking about MI, which is myocardial infarction. So let's take note of that. So in this case, we are looking at pulmonary emboli, where the clot is found in the respiratory system. Let's come to spasms of the bronchi. The bronchi is considered to be an airway. And again, when we begin to get spasms or inflammation of these airways, it causes the airways to narrow. And in this case, air is not able to go to come out, or carbon dioxide is not able to get out of the person, and then we result in what? Building up carbon dioxide. When it happens, the pH is going to be going down, and therefore we get respiratory acidosis, bronchitis. This bronchitis is inflammation of the bronchitis. In the case of asthma, we have the same problem. Airways are narrowing, and therefore the person cannot breathe out the carbon dioxide, and this will result in the building up of the carbon dioxide, which result in drawing the pH down. Let's come to elasticity. In the lungs, they have the ability to expand and also relaxes due to the elasticity. In the case of COPD, air is trapped in the alveoli, and when air is trapped in the alveoli, what happens is that as time goes on, because it's a chronic thing, the alveoli becomes hyperinflamed. And as a result of that, when you take an X-ray, you see that this person will get hyperinflated lungs and the person will be getting a barrel chest. So people with chronic COPD, one of the cardinal symptoms that we see among them is the barrel chest. Now let's come to emphysema. When we talk of emphysema, emphysema is nothing but air being trapped in the alveoli that result in the barrel chest, especially when we talk about barrel chest. So when we talk about COPD, we mentioned barrel chest over there. COPD is a condition where the person has bronchitis and emphysema at the same time. So COPD, think about two conditions, bronchitis and emphysema. Let's look at some of the clinical manifestations that will show up when the patient's carbon dioxide levels are going up. These are things that will alert you to understand that yes, the person's carbon dioxide levels are going up. What are they? Let's look at one. Number one is confusion. They become drowsy. Sometimes they also complain of severe headache, and then blood pressure will begin to be going down. We say hypoventilation, which is where the respiratory rate is going down. Then this hyperkalemia, I'll talk about it when it comes to conditions like diabetic ketoacidosis. Those are metabolic conditions. So stay tuned with that. Now let's come to the interventions. As a nurse, anytime you identify a problem, you also have to know what you can do to help this patient. So in the case of And our interventions, we want to improve ventilation. How do we do that? We can give oxygen to our patients that are in respiratory distress. But when you are giving oxygen, you need to be more careful. You need to be more careful because in the case of COPD, when you give too much oxygen, you are going to force their respiratory drive to go down, and therefore you must lose your patient. So be careful when you are giving oxygen. If the patient came from, let's say, surgery, you give them an incentive spirometer. The incentive spirometer is just a simple tool that will help expand the lungs. And in the other areas, I think I did mention about how to use an incentive spirometer. They will be asking you how to teach your patient how to use this incentive spirometer, especially in the skills section. When it comes to coughing, coughing helps clear the airways. And therefore, when the person can cough, you encourage the person to. If they are not able to do that, one of the ways to what? To also clear the airways is suctioning. So suctioning is very important, but we do suction as the last resort I mean, we have to help the person cough. If they cannot do that, we have to go in and suction them and clear the airways. If they have respiratory failure, then what we have to do is, or we have to think about is mechanical ventilation. This is where we are using the machine to pump in the air and pump out the air. If they are on opioid or anything and you think they might have OD'd on any of these opioid, give them naloxone. The common name that you see out there is Norcan. Whenever a patient is OD'd on any of these opioid, we give Norcan and that will reverse the effect of the opioid. If it is a benzo, let's talk about lorazepam, diazepam, you give them flumazenol. Flumazenol is the medication that we use to reverse the effect of the benzos. I hope by now you understand what it means by respiratory acidosis. Respiratory alkalosis would be my next one that I'm going to talk about. When we talk of respiratory alkalosis, think about the word fast. This is where the person is hyperventilating. They are breathing faster than normal. In this case, think about the respiratory rate greater than 20. So they will be having respiratory rate of 24. What are some of the things that will cause a patient or somebody to what? To be hyperventilating. One of them is panic attack. Think about anxiety. When the person is afraid of something, they begin to hyperventilate. In the process, they are breathing out all the carbon dioxide. This is going to cause the pH to go up. And when the pH goes up, we say that the person is in respiratory alkalosis. So in the case of fever, the same thing happens. Sepsis, where we have a widespread of infection, this also happens. And then when the person is having fevers, what will be our intervention? Give them antipyretics. When I talk antipyretics, what are they? This is medication that will drop our temperatures down. The common example that we have out there is ibuprofen or we give acetaminophen. Please, anytime you are giving acetaminophen, be careful. If they have a liver problem, think about it. Acetaminophen is hard on the liver. You need to question that medication. In case of the kidneys, if you are going to give ibuprofen, think about the kidneys. If the patient has a kidney problems, you need to question that ibuprofen. These are things that I'll be talking about as time goes on. Then the last thing I'm going to talk about is mechanical ventilators. When the mechanical ventilator settings are set too high, it's the same thing as the person being hyperventilating. And in this case, the person is at risk of getting um, respiratory alkalosis. Let's talk about some of the general manifestation of somebody with respiratory alkalosis. One of the clinical manifestations I'm going to talk about is going to be lightheadedness. We're talking about tingling and numbness, tetany. Should tell you that their calcium levels are down, dyspnea, tachycardia, and hyperreflexia. Then the final thing is seizures. So let me ask you some of these questions. What are some of the precautions that you put in place when somebody is at risk of seizures? Hope by now you know that. Yes, we have to get oxygen at bedside. We have to get suction equipment at bedside. We also have to make sure that the side rails are padded. These are things that NCLEX love to ask. Let's look at some of the interventions that you can put in place if somebody is having respiratory alkalosis. The first thing you think about is give them, let them give them a paper bag and let them breathe into it. As they do that, they are breathing back the carbon dioxide. So this helps stabilize the patient. Then you can also take them through breathing exercise where you stand by themselves and ask them, hey, calm down, take a deep breath. I am with you. I've already called your doctor and also I've also called your family members. They'll be here very soon. The third thing you can do is guided imaging or guided breathing. This is where we have a breathing exercise where we say that breathe in through your nose and then you breathe out through your mouth. Hit your lips first. This is what we call pursed lip breathing. They help. Another one we can do is diaphragmatic breathing, which where we are using our belly muscles to aid in the breathing. I'll talk about them later in the respiratory lecture notes. Then always remember, treat the underlying cause. What is causing this person to hyperventilate in the question? If it is pain, you treat pain. If it is a temperature or if it is fevers, you treat the temperature, the fevers with antipyretics. If it is sepsis, think about giving the person antibiotics. But the time you are about to initiate antibiotics, remember, always get your cultures first. If it is a ventilator settings that are too high, you have to think about adjusting the ventilator settings. This table is just telling us what respiratory alkalosis is and then also what acidosis is. You notice that in the alkalosis, everything that I'm going to talk about here is high. Think about it: irritability, dyspnea, tachycardia, loborythmy, spuborrhythmy. Logarithmy is nothing but increased vowel sounds. And then also we have seizures, respirations, hyperreflexia, everything is high. In the case of acidosis, all these things will cause carbon dioxide to be built up in the person. Lethargic, bradycardia, bradypnea, paralytic ileus, coma, respiratory arrest. All these things will result in building up carbon dioxide in the system. When we come to the metabolic side, I will talk about them later. But what I want you to know that in metabolic alkalosis, the person will be vomiting. Now, the reason why metabolic alkalosis, we are saying that the stomach is made up of hydrochloric acid. This is when the person is throwing up or you are having gastric suctioning, you are suctioning up all the all the acid in the person. And therefore, this person is at risk of getting metabolic. I'm saying metabolic because one, I'm not talking about carbon dioxide concentration. I'm not talking about the respiratory system. Then, when the person is having diabetic ketoacidosis, where the blood sugars are so high in the case of type 1 diabetes, they are at risk of getting metabolic acidosis. In all these cases, think about a kidney failure, where the person is building up potassium levels in the system. Think about diarrhea and think about hyperkalemia. Now, I've already given you situations or things that I have already talked about respiratory alkalosis when the person is having a panic attack, hyperventilating, or when the ventilator settings are high. These are things that will result in respiratory alkalosis. In the case of respiratory acidosis, think about acute respiratory failure, asthma, COPD, pneumonia, low ventilator settings.